So, you're here at Deuk Spine and Deuk Joint. Now, you originally came here with your stepmother, didn't you?
Yes, I did.
And your stepmother has a lot of problems, but during the conversation, we commented on your knees.
Yes.
Yeah.
And I'm so grateful you did my knees.
Before we get that far into the
But
conversation,
I am
Yeah.
grateful.
how long have you been having some problems with your knees?
Oh, I'd say at least 15 years.
And it's gotten slowly and progressively worse.
Yes, painful. The pain was unbelievable.
What kind of stuff were you taking for pain?
A hydrocodone.
It's pretty strong stuff.
It is.
You've had discussions with surgeons about surgical interventions.
They wanted to replace my knees
How long ago did that conversation start?
2 years ago.
And you were telling me before you went to Disney.
I did, and with my grandchildren, and I couldn't even walk. It was so painful. I'd have to keep sitting down. It was sad.
Now, when we told you about the Deuk plasma rhizotomy, which is our new procedure for knee pain, it took a little bit of convincing, but after discussion, you decided to try it, right?
Oh, definitely. It was the best thing ever.
And we did both knees.
You did both knees.
How long did it take you to recover from that?
As soon as I got up off the table. I've been walking pain-free ever since.
So it's right after the surgery, you felt instant pain relief.
Yes, I did.
That's awesome.
And I didn't even have surgery pain after either.
Now, your knees are still crooked,
They're crooked.
and they still grind and bump around a little bit,
Yes, they
but
do.
they don't hurt.
No, they do not.
That was the reason you kept going to your other doctors, because it hurt.
Yes. Oh, it was painful.
Now, have you been able to back down off your medication?
I am now. I'm weaning off of them.
Yeah, we talked about that you've been taking it for so long, it'd be
Yeah.
unwise to just stop cold turkey. So that's a good thing that you're weaning off, and you anticipate you'll be able to get off of it
Oh,
completely.
definitely.
Yeah. Isn't that awesome?
It is great.
And, for my entire career, which is 30 years of doing joint replacement, I always only thought that was our only choice, was doing a replacement. There's a number of patients of almost 20% that don't like their knee replacements and wish they never had them.
My husband died from a knee replacement.
Yeah, you were telling me that.
He had a knee replacement, and then they had to cut him open every 6 weeks and put an antibiotic cement spacer in his leg.
And he eventually passed away from complications.
He did.
We don't have to worry about those kind of complications with this procedure.
No, this
Which
is
is wonderful.
fantastic.
Which is wonderful. Well, hopefully, you'll be able to spread the good news.
Well, I called my mother. She has one knee bad, and my older sister has both her knees, like mine were. And I told them both they had to get on a plane and fly down here.
We're getting to the point where we're going to be able to start doing telemed reviews like Dr. Deuk does for his spine, so patients can know before they get here whether they're a good candidate or not. We'll be looking forward to that in the near future. So
You saw my knees, and the very next day you fixed them.
and that very next day you were pain-free.
Yep. And I've been walking. I walked across from the hotel to the plaza where all the mall, all the stores are.
Mm-hmm. Yeah, that's a good
No
walk.
pain.
That's a good walk.
Zero pain. I'm so happy. You're so nice to me.
Well, you're a good patient. Hopefully, you'll be able to, as I say, pass on the good word.
Oh, definitely.
And, your good results will continue. So,
Yes. Thank you
all right.
so
Thank
much.
you so much for talking with us.
Thank you.
There you go.